This podcast is sponsored by Talkspace. You know when you're really stressed or not feeling so great about your life or about yourself? Talking to someone who understands can really help. But who is that person? How do you find them? Where do you even start? Talkspace. Talkspace makes it easy to get the support you need. With Talkspace, you can go online, answer a few questions about your preferences, and be matched with a therapist. And because you'll meet your therapist online, you don't have to take time off work or arrange childcare. You'll meet on your schedule, wherever you feel most at ease. If you're depressed, stressed, struggling with a relationship, or if you want some counseling for you and your partner, or just need a little extra one-on-one support, Talkspace is here for you. Plus, Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance? No problem. Now get $80 off of your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
What are eating disorders? Understanding the different types. Eating disorders are complex mental health conditions that involve abnormal eating habits and an unhealthy preoccupation with food, body image, and weight. These disorders can have severe physical and psychological effects, impacting a person's health, relationships, and overall well-being. Understanding the different types of eating disorders is crucial for identifying the condition and seeking the appropriate treatment. In this article, we will explore what eating disorders are, the different types of eating disorders, and the potential health consequences associated with these conditions. 1. Anorexia nervosa, self-imposed starvation. Anorexia nervosa is an eating disorder characterized by an intense fear of gaining weight, a distorted body image, and extreme self-imposed starvation. People with anorexia often have an unrealistic perception of their body size, believing they are overweight even when they are severely underweight. Symptoms of anorexia include extreme weight loss, refusal to eat, excessive exercise, and distorted thoughts about food and body image. Individuals with anorexia may also develop rigid eating habits, such as cutting food into small pieces or avoiding certain food groups. Health risks: anorexia can lead to severe malnutrition, weakened bones, heart issues, and even death if left untreated. 2. Bulimia nervosa, binging and purging. Bulimia nervosa is an eating disorder characterized by episodes of binge eating followed by purging behaviors such as vomiting, laxative abuse, or excessive exercise to prevent weight gain. Symptoms: individuals with bulimia may engage in binge eating, where they consume large amounts of food in a short period while feeling out of control. After binging, they often attempt to purge the food to avoid gaining weight. Health risks: bulimia can lead to dehydration, electrolyte imbalances, gastrointestinal problems, and damage to the teeth due to frequent vomiting. 3. Binge eating disorder, BED, recurrent binge eating without purging. Binge eating disorder, BED, is characterized by recurrent episodes of binge eating without the purging behaviors seen in bulimia. Individuals with BED often eat large quantities of food in a short period and feel a lack of control during these episodes. Symptoms: binge eating episodes are often associated with feelings of guilt, shame, and distress. Unlike bulimia, individuals with BED do not engage in purging behaviors, but they may feel overwhelmed by their eating habits. Health risks: BED can lead to obesity, high blood pressure, diabetes, and other weight-related health issues. 4. Pica, eating non-food items. Pica is an eating disorder in which individuals eat non-food items, such as dirt, chalk, or hair. This behavior may be driven by a desire to fulfill nutritional deficiencies or compulsive urges. Symptoms: pica is characterized by the consumption of substances that are not typically considered food. This behavior can be harmful to the body and may lead to poisoning, digestive issues, or infections. Health risks: individuals with pica are at risk of ingesting toxic substances or causing damage to the digestive tract. They may also suffer from nutrient imbalances or food poisoning. 5. Orthorexia, obsession with healthy eating. Orthorexia is characterized by an obsessive focus on eating foods that are considered healthy while avoiding any food that is perceived as unhealthy or impure. Unlike other eating disorders, orthorexia is not about losing weight but rather about achieving perfection in food choices. Symptoms: people with orthorexia often have a rigid set of rules about what constitutes healthy food. They may avoid certain food groups entirely and may become anxious or distressed if they are unable to adhere to their strict dietary rules. Health risks. Orthorexia can lead to nutritional deficiencies and anxiety around food. In extreme cases, it can result in malnutrition if the individual restricts their diet too much. Key insight: eating disorders come in many forms, including anorexia nervosa, bulimia nervosa, binge eating disorder, pica, and orthorexia. Each type has unique symptoms and health risks, but they all have significant impacts on both physical and mental health. Treatment is crucial to address the underlying psychological factors and restore a healthy relationship with food.